I think we started using it on those select patients that we knew that either line migration risk could be potentially high, or those patients who will need it long-term for therapy.
What's unique and what me and Kacey actually discussed a few minutes ago are those younger patients, those 2-year-old patients on the oncology unit that need that PICC line to stay in place, need it central for an extended period of time. How do we keep a line central without it migrating on a patient that young, that active, that full of life? How do we keep it in the correct location? So securacath, I think, gives us that, those patients.
And I think with that population too, the thing that's a little bit unique is they pretty much move into the hospital for months to a year, and we try to keep it as normal as possible for them so they can still get on a mat and play with their siblings or their parents, and we really want to make sure we can support that and also keep their line safe. I think even just addressing change, talking about that aspect of how securacath can be beneficial. When you have a 2-year-old who isn't used to that procedure yet, and even with all of the supports like child life and family, it's still a scary thing. And when you have that securacath, you know that you have that extra security with that line.
When we go to a bedside to insert a PICC, and even before I insert the PICC, I say, I'm gonna put a securacath in. The nurse is typically overjoyed.
Yes.
Almost every nurse that we deal with that we say, I'm gonna put a securacath in, like, oh, thank God. So I think there's this sense of comfort in like, okay, I have a line, it's gonna be secured, and I don't have to worry about addressing change that I may not do as often as you do as someone on the vascular access service, but I'm gonna be okay because I know the line's in place, regardless of me taking the dressing off. So it changes the whole atmosphere of inserting your line, essentially.